This a concept was new to me when I joined Apollo Hospitals 3 years ago. Before that, I served in armed forces for 13 years, during which time this was a totally disintegrated approach, where the contention is always between the neuro and the ENT, and sometimes even the orthopedicians come into play for a diagnosis which we have then termed as cervicogenic vertigo, which doesn't even exist as we know now. So when it comes to the experience, the first experience was that we can learn no matter how senior you are in your specialty. So when it comes to dizziness, as Dr. Prabhash had mentioned, it could be anything starting from stroke to a peripheral vertigo. Now, how do we differentiate? We cannot be limiting ourselves into thinking only like an ENT specialist. So that is when the experience of interacting with neurologists have given me an insight into how to look at other central nervous system or a central vertigo-related symptoms, signs, and how to investigate and manage. That was number one. Number second experience is that a patient who enters our hospital should know which doctor to consult. What if the patient doesn't know? In which case, we should be the ones who should make the patient comfortable, making the patient think that they are in the right place. They do not have to move from one consultant to the other consultant, shuttle between consultants. What we have established in Apollo Monogram is one such a setup where every patient of dizziness is consulted by both the neurologist and the ENT. The points collected are discussed together, and a diagnosis is arrived, and then the treatment is taken care of. Finally, it is that experience which has led us to this point where we are thinking to establish a multicentric approach. Let it be a Greenstone Apollo, Apollo 1, Apollo Monogram, Apollo OMR. So the experience has been phenomenal in terms of academic enrichment and also in terms of patient treatment and care.
So I call for Dr. Vijay Shankar, the Senior Consultant Neurologist and Movement Disorder Specialist. So can you highlight the differences between a movement disorder and a balance disorder? If your movement disorder is your highest specialty.
Good morning, everyone. Thanks for coming. And I thank Chairperson Preeta Madam, DMS and Naveen sir. It is important to differentiate between a balance disorder and a vertigo, because any movement disorder, like many people will come to us and say that giddiness, but they can have degenerative diseases like Parkinson's disease, especially a disease called as a multisystem atrophy or progressive supranuclear palsy, or the simple ataxias can also have this type of imbalance. So people think that these diseases can also because of the vertigo. The important thing is the vertigo usually occurs because of the vestibulobasilar system, that which Dr. Prabhash showed a couple of years back, and the ataxias or the degenerative disease like Parkinson's disease can occur because of the basal ganglia and its circuits. The important thing is the role of this clinic is to differentiate between these two disorders. That is pure vertigo, or is it a degenerative ataxias, or is it a movement disorder, and identifying this disease and treating this disease specifically that makes the patient better. And the important thing is the role of the clinic is giving a proper treatment, and the neuro rehab is very, very important, like vestibular rehab exercises and fall prevention. All these things plays an important role. And diagnosis, and when one center we can do all this treatment properly, appropriately, and to cure this patient properly.
Thank you. So I call upon Dr. Venkata Karthikeyan, Senior Consultant ENT, Head and Neck Surgery and Skull Surgery. So what are the common problems that you face as an ENT specialist in vertigo and balance disorders? Good afternoon, everybody.
So we come to ENT-related causes of dizziness. We always wonder why ENT and imbalance, because we have outer ear, middle ear, and inner ear. This inner ear has the organ of hearing and the organ of balance. The organ of balance, otherwise called as vestibular system, results in dizziness. தமிழில் சொல்கிற மாதிரி மயக்கமா கலக்கமா காதிலே குழப்பமானு சொல்கிறோம். அதில் வந்து நம்ம கேட்குறப்ப அதுக்கு ஒரு தீர்வு கிடைக்கக்கூடிய சான்ஸ் இருக்கும். காதுலேயும் அது உள்காதில் எதுவும் குழப்பம் இருக்காங்கிறது பார்க்கறதுக்கு நம்ம we need to do that. ஸோ ENT பொறுத்த வரைக்கும் 6 entities நம்ம பார்க்குறோம், காமனாக பார்க்குறோம். ஃபர்ஸ்ட் வந்து benign paroxysmal positional vertigo. I'm going to change it to peripheral paroxysmal positional vertigo as advised by the great expert Dr. Maestro. Second thing is Meniere's disease. Meniere's நோய் சொல்ற காது கேளாண்மை, காது இரைச்சல் அண்ட் காது அடைப்பு இல்லை இந்த டிசீனஸ் நம்ம சொல்றது கலகரிப்பு எல்லாம் சேர்ந்து வர ஒரு சிம்டம்ஸ். மூணாவது பார்த்தீங்கன்னா அக்யூட் பெரிஃபரல் வெஸ்டிபுலோபதி ஆர் யூனிலேட்டரல் வெஸ்டிபுலோபதி. இது காமனாக வைரஸ்னால வரலாம். நாலாவது பைலேட்டரல் வெஸ்டிபுலோபதி. அது நிறைய கண்டிஷன்ஸ் இருக்கு. கான்வைலாக இருக்கலாம், ஆட்டோஇம்யூன் டிசீஸ்னால வரலாம், மெடிசின்னால வரலாம். அஞ்சாவது வெஸ்டிபுலர் பேராக்சிஸ்மியா அப்படின்னு சொல்லக்கூடிய கண்டிஷன். இந்த பிளட் வெசல்ஸ் வந்து இந்த உள்காதுலேருந்து போகிற நரம்பை அது டச் பண்ணுறதுனால வர டிசீனஸாக இருக்கலாம். ஆறாவது சுப்பீரியர் செமிசர்குலர் கெனல் டேஸ்ன்னு சொல்கிற இந்த மேற்புறம் உள்ள நம்ம அந்த உள்காதுக்குள்ள உள்ள மேற்புறம் உள்ள சுப்பீரியர் செமிசர்குலர் கெனல் சொல்லுவோம். ஒரு கால்வாய் மாதிரி உள்ள அரைவட்ட கால்வாய், அதில் வந்து சிதைவு இருந்ததுன்னா, அதில் இந்த போன் வந்து சிதைஞ்சிருந்ததுன்னா அப்போ கூட டிசீனஸ் வரும். இந்த மாதிரி 6 காமன் கண்டிஷன்ஸை நம்ம பார்ப்போம். இந்த நான் சொன்ன அது மாதிரி உள்காதுல ப்ராப்ளம் இருக்கான்னு நம்ம டயக்னோஸ் பண்ணுறதுக்கு we need to consult the ENT specialist, and a center like combined neuro-ENT will solve this problem. Thank you.